United Kingdom Healthcare System Overview. The quality and access to healthcare services for citizens of a country are primary indicators of the entire health system. Some countries have universal healthcare, while others prefer insurance-based programs. For example, the United Kingdom's National Health Service, NHS, is a universal centralized system adopted in 1948. This system is funded by taxation in the UK's 4 countries, England, Scotland, Wales, and Northern Ireland. The government determines the allocation of resources in England, while the rest 3 states receive funding through the Barnett formula. The UK spends only 9.7% of GDP on the nation's health and medical research. Still, the system's efficiency is generally higher than in the US, which spends 17% of GDP on healthcare. It appears that the British NHS offers tremendous benefits to the citizens, providing regulated universal health coverage. The NHS is a free universal healthcare system that involves referral from general practitioners to more specialized care. Although the waiting time for non-urgent cases is as long as in the United States, UK citizens have equal access to care. The longer time to wait might be explained by the lower proportion of clinicians to clients, 1 physician to 356 patients. However, despite the amount of work medical workers perform here, they are paid less than American doctors and nurses. For instance, the average pay for British nurses is $50,000 per year, compared to the United States' $53,000. The average annual income of the UK's physicians is about $165,000, but it includes overtime and other bonuses, which are not counted in other countries when reporting salaries. Still, the NHS seems to be more focused on providing access to high-quality care to all people than the insurance-based system in the US. The country's legislation supports the professionals' obligations to improve people's health by emphasizing the importance of preventive care. The UK has only 2.6 and 46.5 beds per 1,000 people in hospitals and long-term care facilities, respectively. It shows that the government attempts to make healthcare more efficient by shortening the length of stay and improving prevention and rehabilitation. Indeed, the UK has a relatively high life expectancy and a long healthy life expectancy. The number of patients who skip consultation or prescription medication in this country is much lower than in the United States. Moreover, the British government clearly stated that everyone has the right to end-of-life care and palliation, while euthanasia is illegal in this country. Overall, the legislation in NHS allowed for creating an environment of negligible difference between poor and affluent classes in terms of access to medical care. In conclusion, the UK's NHS provides access to free healthcare to the country's entire population, regardless of income. Although doctors need to work more due to fewer physicians, I think that the British government supports their professional obligations. Clinicians receive relatively fair pay and are encouraged to shift their perspective to preventive care and rehabilitation. Moreover, medical services should be accessible to everyone, and the funding for such a system can be received from taxation, like in the UK. Indeed, the 4 principles of biomedical ethics, justice, non-maleficence, autonomy, and beneficence suggest that all people have equal right to receive medical care. Therefore, I argue that healthcare should be free for everyone because health is a fundamental human right.